Hello, I'm Kristen Coverly, ABMP's Director of Professional Education, and welcome to Lymph Talk, a series of conversations I'm having with practitioners who specialize in the manual lymphatic drainage, or MLD modality. These conversations are in conjunction with the free online ABMP CE Summit on Tuesday, October 25th, 2022, that focuses on lymph, and my hope is that they increase awareness of MLD and demonstrate how effective it can be with different populations. I'm talking today with Rebecca Sturgeon, a massage therapist, manual lymphatic drainage specialist, and the education director at HealWell. She has experience using MLD techniques with oncology and post-surgical clients. Today, we're talking with her about her work with post-surgical clients. Welcome to Lymph Talk, Rebecca. Thanks so much for joining us.
Well, thank you for having me. I'm always happy to talk about lymphatic things.
Yes, I know it's a passion, and the people I've been doing these talks with, the passion just shines through. So I'm so excited to have this conversation. And I think I need to ask you, for all of the people viewing, to introduce your co-host here.
My friend.
Your friend.
This is Bonkers. She is famous. And if you've ever been on a HealWell Zoom with me, you've met her. So she's not a fan of the lymphatic drainage, though, but that's okay. I love her anyway.
Oh, Bonkers. Okay. Well, let's jump in and talk about how much a fan you are of MLD.
Yes.
Let's start at the beginning, though. What inspired you to want to specialize in manual lymphatic drainage?
Yeah, so it was kind of an accident, as many of the best things in my career have been. I was doing oncology massage at a cancer treatment center and realized that lymphatic drainage was needed. So they sent me for training in lymphatic drainage. And as soon as it for me became like this beautiful combination of science and physiological knowledge, plus the kind of touch that I was never taught to do in massage school, but just felt like, oh, right, this is how you soothe the human body. Along with the creativity that's inherent in being a massage therapist. So it was just like this wonderful accident.
I love it. And yeah. It is funny, isn't it, how things are introduced and you just have to have your eyes and heart open to the new experience and who knows where it'll lead.
Exactly.
Yeah.
Exactly.
Oh, I love it. So you started using MLD with oncology patients.
Yes.
You also now use MLD with post-surgical clients. So let's talk a little bit more about that. So tell us, what type of physical condition are these clients in when they come to see you? How close to their surgery date are you seeing them?
Yeah, well, it depends. The majority of my my post-surgical clients are post-elective plastic surgery. Mm-hmm. So we're talking about things like liposuction or I forget the name for it, but the skin reduction surgeries. I see a lot of BBL, Brazilian butt lift clients. And for where I live in the country, most of the people who have those surgeries go somewhere else to have the surgery, and then they come back home for recovery. So it could be as soon as like 3-4 days, I think was the most recent. It could be a couple of weeks out. It's usually within the first 2 weeks.
Got it.
Yeah.
And what's happening in their bodies at that time, typically?
Oh my goodness, it's so much, so much. There's a lot of recovery from invasion happening in their body. So there's a lot of swelling. Mm-hmm. There's a lot of fluid that collects in areas where tissue has been removed or reorganized or added. So we see a lot of swelling, a whole lot of pain, and I see people close enough to their surgery date where there are still, I've seen people who still have like their drain, their external drain, or they have incisions that are still covered because they're not fully healed yet. So these are bodies that are real busy and just need support.
And would you describe it as, even though it's an elective surgery, it's still to the body trauma?
Absolutely.
Yeah.
I would 100% use that word. Especially since I took the time to actually watch what I could, on the internet and whatever else of what actually happens during these surgeries, because I wanted to understand what's actually been done to your body.
Yeah.
So that I could kind of understand what I was feeling. I'm very glad that I did that because it helped me explain what I was feeling. And I'm also really sad that I did that because it's a lot. Yeah, it's a lot.
Yeah. Oh my goodness. And like you mentioned a few of the different types of surgeries, but there's such a array of different surgeries, and this is elective. And then you think of, okay, then we've got surgeries that happen because they're required for health. And like this post-surgical field is wide in scope, isn't it?
Yeah. Yes. Yeah. Yeah, it's huge. And not to say that I have definitely worked with people who have had reconstruction post cancer related surgeries. Just so happens that the population that finds me now happens to be this one.
Yeah. So what are your goals? So you've got someone coming to you post-surgery, maybe within that first week or two. A lot's happening in their body. What are your goals with MLD in a session? Maybe, and I'm guessing the goals shift over time, but tell us more about that. Yeah.
Absolutely. Yeah. So it depends. Primarily, like when it's very soon after surgery, there are a few things that are kind of universal, and it always depends, right, on this person and their body and everything else. But pain reduction, some reduction of swelling, and improvement in mobility. Like those are the three things that are across the board. I could say are pretty much always goals. And then as people begin to heal, you sort of feel how their tissues want to be. You might get more into things like, we don't do tissue remodeling, but we can, what we do is working with swelling and the way that fluid is draining to support what the plastic surgeon has done as far as reshaping tissue.
Yeah. And do you do strictly MLD sessions? Are you combining them with any other hands-on techniques? Tell us a little bit about that.
Yeah, for most of these clients, the post-surgical clients, it's strictly MLD. Because a lot of the people that I'm seeing, it's so soon after surgery that a quote unquote regular massage, it's not necessarily contraindicated, but it's not comfortable.
Right.
Even a gentle massage can be a little bit much.
Understood. So let's talk about those clients a little bit more. Can you share a client story or two that really demonstrates the effectiveness of MLD post-surgery?
Oh my goodness. I was just talking to some friends about this the other day. And there's so many. There are a number, particularly the Brazilian butt lift clients. Those are the ones that feel the most dramatic to me, because that is a very dramatic surgery. It's traumatic, it's dramatic. There's a lot that happens to your body. So the support of that can, in some cases, yield dramatic results. So I've had people would come in, walk in sort of bent over because of the pain and the swelling that they're in their abdomen and around, are unable to stand upright.
Wow.
So they'll walk in bent over and leave standing upright.
Wow.
And again, the body is still healing. There's still going to be fluid. They're going to come back next week and probably be bent over. But if they were able to stand up, straight for a day, that's a win. I've had people tell me that they had a good night's sleep for the first time since the surgery after coming on a regular basis. My favorite story, however, is a little bit, if you're not kind of a body nerd like I am, can be a little bit gross. Is that okay?
Yes, I think most of us that are tuning into the Lymph Talk are also body nerds. So let's go for it.
Okay.
Warning on screen. Warning on screen, everyone.
Just trigger warning. Yeah, strange things that your body does. So every client is different. We all know that, right? But really, every BBL client is so different. The way their tissues feel. So there was a person who came in, and she had her BBL about a week before she saw me. And the way that the swelling was in her body, what would happen is as soon as I put my hands on her skin and moved it, I could hear the fluid, like physically hear it. So it was like,
really?
Yeah. And like every single time. And it's not just you don't always feel the fluid. Sometimes you can feel it and it's really satisfying when you feel it and then you don't feel it anymore, or you feel less of it. Like this, I could both feel it and hear it.
Wow.
And like I knew that I was done in an area when I couldn't hear it anymore. That was like the first time in any massage ever that I've gotten such a clear audible cue that like, oh, right. Okay.
Right.
So you can move to a different area. It was like,
That's so helpful.
Oh,
Yeah.
good. Okay. Oh, okay. This area is done. And it was only one time, like she, as most people are recommended to do, came in for multiple sessions. And it was only the first one that happened. The next time she came in, I was like, oh, okay. I mean, that's good for your body, but
right.
wow. So I already knew that MLD does stuff, right? And that this is an effective modality, but having like such very clear feedback was kind of amazing. And that's like totally selfish from my point of view. She did feel that she was in less pain, was walking better when she left. So definitely the client got some benefit, but that was just so selfishly satisfying.
And what a surprise at first. I'm sure initially you were concerned, probably a range of emotions triggered. And then when you figured out what was going on, you're like, okay, got it.
Yeah. It was because I think bodies are amazing. And I think when our bodies do weird stuff, that's even more interesting. So like the first movement that I did when I heard that, I was like, oh my God, this is going to be the most fun session ever. It's going to be amazing. And it was.
And I like that you mentioned too, in addition to this one particular client where with you had the auditory cues, but that you also say that sometimes you can actually feel the fluid, even though it's such a gentle, light touch, and not always, but sometimes you can actually feel the fluid moving. Yeah.
That is for people who get abdominal liposuction in particular. And as many of the people that I see, they get the 360. So it's fat removal from the front and the back and the sides. You can, or I can, many times feel the fluid, and you can kind of feel the way that it wants to drain. Because there's so many lymph nodes in the abdomen. We are taught the physiology of the lymphatic system, and hopefully also understand that bodies are different. Textbooks can only take you so far. So it's really satisfying to kind of feel the fluid and feel the way that it wants to go. And that's where the creativity of MLD comes in. You need that solid science background, so you really understand how the lymphatic system works, so that when you are faced with a pocket of fluid that the textbook tells you wants to drain to the right inguinal nodes, and the fluid's like, nah, that's not where I want to go.
Interesting.
That where your other options are. Yeah.
And with time, I'm sure you develop that confidence.
Yes.
To trust what you're feeling and making those decisions in the moment.
Absolutely.
Yeah.
Yes.
Oh, so exciting. We could talk to you about lymph and manual lymphatic drainage forever, for hours. But I love that you're able to give us a really good look at MLD and how it can really help post-surgical clients in this Lymph Talk conversation. Thank you so much for joining us. I really appreciate it.
Well, you are quite welcome. Thank you. This was super fun. And yeah, if you ever want to talk for hours, let me know.
I will. Everyone, learn more about Rebecca and her work with HealWell at healwell.org, and learn more about the free online ABMP CE Summit on Lymph at abmp.com/summit. Thank you so much for joining us. Take care.